Around the Ozarks is now on your FM radio. Listen to Around the Ozarks mornings with Grace Gooley as I spotlight local people, stories, and podcasts, all while playing the country legends of the 90s and the hit makers of the 2000s. It's on the Ozarks' best country, 105.1 The Bull.
You're listening to The Real Deal Conversations, a podcast designed to encourage, inspire, and equip you by sharing real stories and meaningful conversations that bring real life to the surface. I'm your host, Megan Deal. Let's dive in. This episode is brought to you by Ozark Veterinary Clinic. This week, I am with Katie Gerwel, who is a licensed counselor and now recently licensed in perinatal, so LPC and PMHC. Yeah. And she is with Healthy Roots Counseling in Republic, Missouri. So at the end of this episode, if anybody's like, wow, that's the person, like this is the answer to my prayer, this is Katie is in Republic, so you can utilize her. Katie, thank you so much for coming on.
Thank you for having me.
So, okay, we're going to talk perinatal depression and postpartum depression. Mm-hmm. And as I was just telling you, so I had postpartum. I'm in my fourth pregnancy now. I have a 16-year-old, a 13-year-old, and a 10-year-old. And my first pregnancy was postpartum psychosis. I look back on it and I do wonder if it was postpartum psychosis or maybe the level underneath. I don't know. Anyway, it was bad though. And then my second pregnancy was easier. My third one, I had perinatal. And we'll kind of get into some of the symptoms I had in the first one and in the perinatal, just because I want to normalize for some people. And then here in my fourth, just being proactive, you know, it's been a lot easier only because I talked to my doctor beforehand, got the medication, So there's my story on why this is so important to me. Can you share why it's important to you?
Yeah. So I have 3 children myself. My oldest is 14. And when I had him back in 2011, it was a confusing time. I was one of the first out of like my tribe to have a baby, and it wasn't necessarily on my timeline. I was married. Everything on paper looked like this should be really good for me, but it didn't. And I love my son. I loved him the day he came into this world, but I didn't feel that whole like, oh, this is my purpose in life. I had some other factors happening at the time too, where I just felt like, why am I not so into this? Nursing was hard. Everything just felt hard to the day. And I didn't know what to do. And I kind of also had that whole complex of, I have a master's degree in counseling. I would know if I was struggling type that we tell ourselves. And it was finally, actually, he was about a year old when I went to my PCP, and he actually put me on medication and said, I think you need to go talk to someone, because I had gotten really angry. Anger was a huge emotion that up until that point, I didn't allow myself to experience. But that point, bless my husband's heart, he had to put up a lot with that first year because I was refusing to admit I needed some help. And so finally I did, and I realized, all of this started when I had my son. And again, love him. But at the end of the day, it was just a really hard transition. I was about mid-20s. And again, a lot of my friends weren't there yet. And so I just felt very disconnected from everything.
Well, and I think too, something we also mentioned, you and I, is the education piece. And when we're new moms, especially, it's our first time and haven't gone through it, we're educated on, okay, we're going to have a baby. It's going to be hard because they cry. We're going to have to diaper. Like, you're educated on all the basics. You're not educated on the massive hormone dump.
No.
You're not educated on what that hormone dump does to you. And so when that hormone dump happens and all these things happen to us, we think we're doing something wrong.
One thing I also kind of felt back in 2011, at that point, we had heard of postpartum depression. That equaled like killing your children.
Yes, because that's what you saw in the news.
Yes. Andrea Yates is the big one that comes up. And I actually mentioned her later, like when I was organizing my thoughts about postpartum psychosis, like that is what I thought. So when my OBGYN did do a little screening at 6 weeks, no way in heck was I going to admit
100%
that I could have postpartum depression. I don't want my baby to be taken away. I don't want someone thinks I'm going to harm him.
Yes.
Because I didn't want to.
Right. So that's exactly what happened to me.
Yeah.
It was my first child. I was 22. And the thoughts I were having were not about him. Now, I do want to say this, just because we both said the thoughts were not about our child, if you're listening and the thoughts are about your child, don't be like, oh, well,
no,
I'm not. Yeah. So it just happens to be our experience. But the fact that you're having the thoughts about your child, we'll normalize that later.
I was going to say there's so much about the thoughts.
Yeah. So I don't want you to be like, oh my gosh, feel shame immediately, because that's not the case. But I thought the same thing. And it took me 6 to 7 months to finally reach out for help, because I thought if I tell my doctor what I'm experiencing, they're going to take my baby.
That's exactly what I thought too.
Yes. And I think even though we don't see in the news as much as that, what we saw before, postpartum equals killing, but it's still there. And so you still think that they're going to take your baby, and it's scary. So the whole purpose of this, and we're about to dive in right now, is to normalize all of this and educate. And because this is something that Katie specializes in, I'm very excited because she's really going to bring the education for you guys. And I hope by the end of this episode that the education and Katie and I just sharing our own experiences empowers you to step into pregnancy and postpartum, encouraged and empowered to speak out and get help and not feel shame. And I really want you to be released from shame if you're holding it. So, Katie, what is actually happening in the brain and body?
It's pretty wild. So during pregnancy and right before you labor delivery, your estrogen and progesterone are the highest they'll ever be in your ever when you're pregnant. So an average woman will never have these levels as high.
Yeah.
But then as soon as baby is into the world, they come crashing down pretty much instantly. But they say within those first 2 days, oxytocin and prolactin jump up. That is for attachment, bonding, nursing, all those things like the love hormones. However, and this is one thing too when it comes to this shame, and I can really deep dive into this.
Please do.
There's a lot of mitigating factors that can really determine what will bring you like the normal versus what kind of is a little bit more clinical of concern. And one of those is if you've always had hormone imbalances or problems, if you've had PCOS, if you've had PMDD, which PCOS, polycystic, ovarian syndrome, sorry. Not a doctor, so I had to learn a lot of these acronyms. And then PMDD, which is premenstrual dysphoric disorder. If these are things that are in your background already, it's going to make that much more of a risk factor for you. So anyway, hormones are going out of whack. So this was the statistic I felt like every woman needs to know. Right as of right now, up to 80% of women will have what's called the baby blues. That's the hormones going crazy. That's being exhausted from having a baby. If you have had a cesarean, that's a major medical procedure. So all this stuff is happening in recovery. Baby blues is about that it starts about those first 2 days. It can last up to 2 weeks. It's also really normal. You also feel very much like on one minute I'm in love, like this is so great. On another minute I'm crying at a Hallmark commercial or like an ad we hear or something. That's all very normal. There's nothing wrong with you. It's just our hormones trying to get all balanced out.
And that sadness, so is it also normal to feel little bouts of like hopelessness and sadness?
Little bit.
Yes,
little bit.
Yeah.
The biggest thing, and I think that this is where the education comes in, what shifts us from baby blues to say this might be something a little bit more is timing.
Yes.
So again, after 2 weeks, you're sad. It is not baby blues anymore.
Okay.
Period. Like full stop. That's kind of what timing, onset. So if you're 1 month postpartum and all of a sudden you're starting to notice these big emotions, it's not baby blues. It's not normal. And then, intensity. Yeah. So that's why if even in the first 2 weeks, you're having some pretty scary thoughts already because actually postpartum psychosis also will kick in with those first 2 weeks. Okay. That's something too to just kind of be aware of.
Okay.
Again, when I say it's not normal. I don't mean to like shame people in that phrase. It's more just this is something to pay attention to and communicate to your team around you, which is another thing I want to talk about later as like a protective factor for yourself, your support system.
Yeah. And I want to go back before labor, the estrogen and progesterone being the highest they will ever be. Is that what triggers perinatal depression in some people? Like what triggers the So my experience with perinatal depression was my third. And I was having suicidal thoughts.
Yeah.
Totally not me.
Yeah.
Not me at all.
Right.
And the fact that it was happening, I was like, which scared the crap out of me.
Absolutely.
Because I thought, this isn't me. And it felt like something was just taking over my mind.
Yeah.
And
so I wouldn't necessarily blame it all on the hormones.
Yeah.
Like I said, when we look at this whole holistic person, biological factors, I've already brought up PCOS and PMDD. If you've had any, even just diabetes, if you have a history of perinatal mood disorders, if you have, I'm trying to think, infertility, like if you've been on a lot of infertility treatments to get this pregnancy, these are all biological risk factors that if you've had this in your background, it can increase your likelihood of developing another, whether you've had one before or not, but developing, and they really say perinatal mood and anxiety disorders. It's like this big umbrella.
Yeah.
Other factors are more the psychosocial. Have you had a history of anxiety, depression? Have you had a family history of bipolar disorder? Have you had trauma, which I get into later too? Have you had a history, maybe a poor relationship with your own mother, whether it's strained, whether she's in your life and you guys argue all the time and never see eye to eye? These are all... If this is in your, and I call trauma a backpack, or all the emotional stuff we kind of go through day to day, a backpack. Trauma is a big cinder block. We're talking about sexual abuse. That's another thing that if that's in your background could put you at risk. Anything that just weighs you down.
Sure.
And when your backpack's already really heavy, then you throw all these hormones and this huge medical change in your body going on. Yeah. It's a perfect storm for some of these perinatal mood and anxiety disorders.
Interesting. Okay, that's interesting. Because I just figured like the hormones were going crazy, but yeah, I didn't even think about all that. So the estrogen and progesterone, just to explain to people, what does the estrogen and progesterone do? So, because it's high, do you know what it does? Like, do you have that?
I'm learning every single day, I feel like, about hormones.
Well, so, and just for people, estrogen having that big hormone dump, it's actually one of the things that is in my plan of care.
Okay.
So because it's a big dump, I'm doing an estrogen patch.
Oh.
So I did that with my third, and I just did the estrogen patch for like 3 or 4 months after, but it was to level out that massive dump.
Okay.
And so that's my plan of care again for this pregnancy is to do the estrogen patch. So, and when I say any of this, guys, talk to your doctor.
No kidding.
Don't be like, oh, well, that worked for Megan. No. I'm telling you what, between me and my doctor, our conversation. And if you want to ask your doctor if it works for you, please do. But don't take anything I say medically advice.
Well, and I'm not a medical doctor either. And I have actually a colleague that works in my office, a nurse practitioner, who's getting very well schooled in all the hormones. I've done my own, later in years, so I've done my own research on like perimenopause and hormones. So I do know some of the function, like progesterone, that helps you get pregnant, really. Yeah. Estrogen is such a funny hormone. Like when that's all off, your anxiety already is high, like in general. So that's what I'm saying. Like I'm not a medical doctor, so I haven't deep dove into all these hormones.
Is it Macaulay?
Yeah.
She's coming on.
Perfect.
Yep, she's going to talk about the
hormones. She honestly could probably talk very well about all the hormones and their functions and why we need them balanced out and all that type of stuff. I love they have a provider that's willing to do, I would say outside of the box, because that's not the norm I hear.
Yeah, it's not. So, okay, all these hormones are going wild. The emotions are affected. So we have baby blues, we have postpartum psychosis that can happen in the first 2 weeks. It doesn't have to though, right?
No.
It can still come on later.
It can come on later for sure.
Just to give that little education piece. Okay, why can symptoms feel physical instead of emotional?
It's because it's all connected. The brain, the body, we work together. The brain, especially our emotions, are processed through a lot of times in our automatic nervous system. And when something, and I say, even just having a baby, and I talk about birth trauma is a real thing too. You could have very few risk factors going into that labor delivery. You have a birth trauma, and then all of a sudden, you're at risk for perinatal PTSD or OCD or anxiety or something along those lines just because of trauma. Trauma is processed in our nervous system. It's very sensory based. That's in the body. So you're anxious, or me personally, I get anxious, my stomach drops.
Yeah.
I have that feeling every single time, and I've done so much therapy and work on myself that I know when that stomach's dropping, I just stop and think, what is going on right now? Why am I anxious? And so it's just connected.
Yeah.
That's why you can't separate mental and physical health, because we're a holistic human being. Every system is connected in our body in some way, shape, or form.
And so what are some of the things, okay, let's go to people that you've worked with before. And what are the most common things, symptoms that you have heard people come to you about, both mentally and physically, in the postpartum anxiety space? Like, what are some of the things that they come to you sharing, just so that we can get some of these symptoms out here and people can go, oh, that's me?
Yeah. So anxiety, depression, they're like, the hard twins in our lives. Like they go hand in hand very well. But I think one thing with anxiety I hear a lot with women is keyed up, restless. I can't relax. I can't sit down. I got to keep moving. I just feel if I sit down, it doesn't feel like I can't do it. I just can't sit and relax. So then sleep is effective. A lot of times you have a lot of stomach GI issues because of it. A lot of these women get diagnosed with IBS. Great. That's a diagnosis. They don't have a treatment for it.
Right.
And really, when you dig down deep, it's actually probably mostly mental health related, which I wish more doctors would just say, hey, if you have IBS, maybe you need to go talk to someone.
Yeah.
But that's what I hear a lot.
I get hot flashes, hot flush, like internally. It feels like on the inside, it gets real hot. And the physical symptoms, I think, are really scary because you think your body is about to do. And then when you're not educated, you're like, oh my God, what's happening? Am I about to have a heart? And you have all these physical symptoms. And then,
a panic attack, so many times people go into the hospital thinking they're having a heart attack when really it's a panic attack.
Yeah.
Because they feel so similar.
And then even, if you have not had any of this before pregnancy and then you have pregnancy, and again, there's no education to the extent of it, it's even scarier because you're thinking something happened to you from pregnancy.
Right.
And it's like going to be a permanent thing. And
I didn't even include it with some of my research, but one of the things I've learned is when we have untreated perinatal mood and anxiety disorders, it does affect if you want to have any more children. Like, why would I ever put myself through this again? And so, which is fair.
Yes,
fair.
That was my third is when I had the perinatal, and the suicidal thoughts freaked me out so bad. And they put me on a medicine that honestly I never should have been put on. And then I had to see a specialist. It was a specialist actually that put me on that medicine, and should have never been put on it. I don't think I don't think there was enough education for depression and perinatal. And I think that was 10 years ago. And I truly believe he was just throwing something out there to help with no understanding.
Right.
And he said, your hormones don't do well with your brain. You probably shouldn't have kids anymore.
Oh.
And that was traumatizing to hear.
Absolutely. And I do think well-intentioned, for sure. I think a lot of our doctors, I don't knock doctors. They're, when it comes to medical stuff, well-versed. But also, some of this hormone stuff is fairly new now with their research. And if you're a doctor seeing, my one friend said 60 patients a day. How are you able to really keep up on latest research and really dig deep with a patient to know where we just go with what we know, what we're told? And I don't want to ever knock a doctor. They work so hard for us. Yeah. It's just at the end of the day, there are some things that they're just not well versed in. I believe I was told, again, I've been doing my own education on perimenopause, and finding out that even OBGYNs in med school don't really deep dive into hormones, which it was mind blowing to me. And I got that from Dr. Mary Clay Haver. She is all over social media, OBGYN board certified. She has a book called The New Menopause, and that's where I got it from. She said, I didn't learn all about this. So I'm hearing it from like a source.
Yeah. And being told in my third, you don't need to be having kids anymore, your hormones don't. 10 years later, I'm pregnant, and I didn't even have that experience at all.
Yeah.
And so every pregnancy is different.
Yeah.
And so to judge your next pregnancy based off your last mental health status in pregnancy, I mean, we wouldn't be having Evie coming had I stayed in that fear.
Right.
So anyway, just again, putting that out there.
And one thing I want to, with my new certification, with this passion, one of my goals is to get in with doctors.
Yeah.
And that they don't have to actually research too much. My certification in perinatal mental health is through Postpartum Support International, which is a beautiful organization, nonprofit. Every service they offer to a mom is free. Like they just have free support groups. But one of the other things they have is a consult line for prescribers. I'm not a prescriber. I could not give anyone medication. I have learned about medications through my certification program, but I can't prescribe anything to anyone.
Yeah.
So if a doctor's like, maybe even listening to this, like, whoa, like, there's a free hotline. Call it up.
Yeah.
Hey, I have a woman, give the background, and that perinatal specialist in reproductive psychiatry will give you a recommendation so that the right medicine is getting to the right people, and that I think anyone in this field just wants women to feel more confident, more empowered in their perinatal period, which I do want to say, perinatal, if you've never heard this before, the time frame that we are referring to is conception through first year of life, or first year after birth, sorry. And so that's a long period. Yeah. That's almost 2 years.
Yeah.
And then postpartum being once baby is delivered through first year after delivery. So I just want to make sure when we're using these terms, you know what we're talking about.
Yeah. No, 100%. Yeah, I forgot to mention that.
Yeah, me too.
Okay. So brain and nervous system changes.
Yeah.
What is nervous system dysregulation? So what is happening in the nervous system dysregulation? I personally love, this is the stuff, these education pieces are personally what really encouraged me. I love to learn about what is actually happening on the inside. Because if we know what's happening on the inside, we can go, oh, I'm not weird. Like,
yeah.
So what is the nervous system dysregulation in all of this?
I just think having a baby, there's so much sensory.
Yes.
When we're talking about noise and smells, I mean, we all know what the smell of a hospital room is. It's that cleaner.
Yeah.
It's very distinctive. And so let's say, and I do believe there's a level of trauma with having a baby, especially
100%.
your first time.
Yes.
Even if you have the most like low risks going into that delivery, we're literally talking about a part of you is removed from your body.
Yeah.
Whether you delivered, vaginally or cesarean, it's gone in like seconds.
Yeah.
So there's a level of trauma there.
Yeah.
And again, if we're processing all this through our nervous system, it's very sensory related. Nervous system dysregulation, it can happen for being hungry. It can happen when you're tired. It can happen for a very, minute situations. Like it might be something that you experience daily, can put you dysregulated. It's more sensitive if you've had, again, a lot of bricks in those in that backpack. If you have big childhood traumas, big traumas, even in young adulthood prior to having that baby, it's just going to make it that much harder to be regulated. I've had women just say, I never feel calm.
Yeah.
Especially after having a baby. I just feel on edge 100% of the time. I don't even know how to regulate. So we do that. That's like first step. I have to make sure, and a lot of times with the therapist, we're co-regulating. That means I'm cool, calm, collective. I'm trying to instill hope. I'm making eye contact and helping. Just my environment's very calming. Some people walk in there, I could take a nap here. I said, that's designed that way. Like to feel like, okay, I can exhale. So
that's one of my postpartum plans is the space. And this is actually the first pregnancy I've done it, is designing my space intentionally for what do I need this to feel like when I come home with that baby.
And I would even argue trauma-informed support birth plans can also bring in you can say, I need the lights dim. You can say that. As long as there's nothing big medically happening, they don't need bright lights in that delivery room while you're laboring.
Yeah.
And I guess it depends on your hospital. Some rooms are different. But like if you're just in that room laboring, they can have dimmer lights. They can have it be more relaxing for you. And you can advocate for that.
Yeah.
I don't think... most healthcare workers I know would love to make their patients comfortable.
Yeah.
So I would empower you to advocate for that too during laboring. But yes, I work a lot. When I'm working with a pregnant woman, we are talking about what is coming home going to look like for you. Who are your supports? The main trainer, the biggest like name in my training, her name's Bertie Gutenmeyer. She had a quote along the lines of, in our lives, we have seasons of giving and receiving. When you are a mom and you're postpartum, bringing this baby home, you are in a season of giving. Nothing else matters but you and baby. That's it. Everyone else around you. So if someone's like, let me do a meal train, let them. Let me come over and do a load of laundry. Let them. Again, if we go back to medical and like, if you've had that major surgery of a cesarean, like, you have to rest.
Yeah.
You can't be, okay, baby's sleeping, now I'm going to get my to-do list. And if that's really hard for you, that is a sign. Let's go talk to someone. Let's get some support here because your body needs the rest to fully recover from that major event.
Yeah. And putting yourself in the mindset, because I am somebody who loves to be busy. And if I'm not doing something, I feel bad. So, but a new mindset that I developed was, even though I'm sitting here, I am doing something powerful. I'm allowing my brain and body to rest.
Yeah. And a lot of times I'm giving, again, with co-regulation, I'm giving that woman permission to rest. And I'm telling them to repeat after me. I give myself permission to rest. And they feel so silly doing it. But until they say it, they don't actually understand it.
And they need to hear that there's permission.
Yeah.
It's a big deal. And I changed, because I'm due next month, my bedroom, I changed all the coloring to a very calm green and put some plants in there. And I said, okay, what is going to be the most calming? Because I know what this is going to feel like. I mean, even if it's not terrible, you're still overwhelmed with just dysregulation. And then in my bathroom, next to the toilet, I put a shelf with all my postpartum care.
Oh, lovely.
In one spot. So like your sprays that help with pain, your cooling packs. And again, this is the first pregnancy I'm doing this, but it's because I've learned from previous ones how important it is to set yourself up for success for the things you can't control.
And if you've never had a baby before, you don't know that stuff. You don't know that. I tell new moms, make sure you have a comfy chair or a sectional or a place where you're going to nurse, if that's what you're choosing to, if you're able to do that. And make sure you have a nightstand or an end table, or even I've seen some of those sectional like little tables you put on the couch cushion with Kleenex and snacks and water and something to read, and just you might be there for a while.
Yeah,
that was something. My first, he ate all the time, so all I did, I felt like for the first 3 months of his life, was sit in a recliner and feed a baby.
Yeah.
So have stuff there that's just within reach. I remember I had a friend at the same time also have a baby. We weren't very close, but she did bring me a box of Cheerios.
Yeah.
She goes, here, trust me. And I was like, and this is before I had the baby. I was like, why do I need a box of Cheerios? Oh, man, that was a great snack to have.
That's awesome.
Yeah.
So things you don't think about.
No. And so you know this now because you've had 3 kids. But when you're brand new, this is the type of stuff that I try to prepare pregnant women with. Like, okay, your whole, and they never know. They never truly know how life-changing this truly is.
Yes.
No one, even when you try, you're like, have this beautiful plan. It's never what it seems.
Yeah. And one of the other things that I did this yesterday, because you feel gross.
Oh,
you feel so gross.
Yeah.
So I bought cute, comfy loungewear.
I have told people who are on maternity leave, if you feel up to it, try to change.
Yeah.
Every day, even if it's to another loungewear, another PJ set, another set of leggings. It just makes you feel better.
Yes.
Yeah.
And showering, it's hard to shower. Yeah. Not because, one, because the baby, but two, the motivation isn't there. Mm-hmm. And so I told my husband the other day, and he looked at me like I was nuts. I said, Daniel, I'm just going to let you know the first couple weeks that we are home with the baby, it's going to be hard for me to shower. The motivation's not going to be there. You're going to say, Megan, you need to shower, and it's still going to be hard for me to get up and do it. I know myself. So I said, in the plan, what I need from you the first 2 weeks is to gently say, let me walk you to the shower.
Yeah.
And it sounds silly, guys, but until you're in it, you have to come up with ways to navigate it. And if it means, hey, I know myself well enough to know I'm going to need a shower, but hormonally, exhaustively, the motivation's not going to be there. But I do know if my husband just gently walks me to the shower, gets me in, I'll be good.
Yeah.
And so having those things, just foreseeing and knowing yourself, and even in the first one, you may learn stuff about yourself. You may go, oh, I didn't know I'm going to have a problem with the shower.
Yeah.
But having that in your plan of care is going to be huge. Just things like, not that specifically, but things like that, having cute, comfy clothes.
Yeah.
The things that you can control,
right,
to help balance out the things you can't.
I think a support, that's why a very detailed support plan.
Yes.
And knowing what helps you now. We play on that.
Yeah.
You know what? Having a shower even gives you time.
Yes.
And even though, yes, initially that baby is kind of the ruler of that house, that doesn't mean you don't get any time just for you. It doesn't. And I never took that. All 3 kids, I never thought that, I always just felt like I'm the I nurse. Yeah. I don't go to work because I'm on maternity leave. This is all on me. No, it's not.
Yeah.
It's not. And that's where I think women, there's a lot of assumptions surrounding motherhood, pregnancy. I mean, the list is really endless at this point, but we have so many preconceived thoughts about this whole perinatal time period. And there are some realities that we all just need to say out loud. Yeah. Not every pregnancy is wanted. Not every pregnancy you come home with a baby.
Yeah.
And these are really, I know, hard things for some people to hear, especially if you've gone through this before. Yeah. But it's the reality of this. Yeah. And these assumptions, unfortunately, and especially social media makes this so worse because you see the cute little bumps and these, tiny little arms and legs. That was not me pregnant, not at all. You see happiness and joy. Yeah. And when you're not feeling that, okay, what's wrong with me?
Yeah.
And I guess my biggest takeaway when I went through my training and what I try to instill hope in my clients is that, again, we're taking shame out of this because you're not alone. The biggest statistic that is almost eye-opening why we need to spend more time talking about this is 1 in 5 women develop a postpartum mood anxiety disorder. So postpartum depression, psychosis, anxiety, OCD. 1 in 7 will develop it during pregnancy. That's a lot of women out there walking around being like, what the heck is wrong with me?
Yeah. So, and then not saying anything because you also have those people out there, they're like, well, I never experienced that. But it's said in a way of that's weird for you.
Well, and some of that I lean into okay, if you're that judgmental, maybe you did have it actually. And you're being defensive about it.
and so it's or it's not going to be received or somebody's not aware of it. And it's hard to talk about. Hard to talk about.
And what's also beautiful is I don't like to leave out men.
Yeah.
When your partner is struggling and, I don't know if you've ever talked with your husband about it, when they're seeing the love of their life being a shell of a human being because of a perinatal depression, mood disorder, they feel so helpless. When a man feels helpless, they don't know what to do. They just kind of, a lot of times, just go inside.
Yeah.
And 1 in 10 men do qualify for depression when their partner is in perinatal.
Interesting.
1 in 10. And only 3% of them will actually get help because in our society, they can't say I need help. I mean, hopefully, because mental health, especially men's mental health, is starting to be talked about more. Hopefully, they are getting more help, but they're supposed to be this strong, tough guy. And and especially if your wife is the one with postpartum depression, why would I admit I need help? What does that say about me? So that was another statistic where I was like, 1 in 10, there's a lot of men out there walking around. And so then if you have two parents both walking around with depression during postpartum, I mean, that's a big disruption to the family unit.
Okay, so twofold. One, let's talk about some of the things that you tell your clients when they are having a nervous system dysregulation. Okay. What they can do in those moments. But then I also want to go into, after that, what conversations can be had for a husband and wife both to feel safe, for both to get help before it happens.
Yeah. So I go to a lot of mindfulness techniques. It's slow, deep breaths, which I feel like a lot, if my clients who start with me have ever seen a therapist before, they almost roll their eyes. Like, I know I'm supposed to breathe, but do you actually know how to truly breathe down to your diaphragm? Because that's a very specific way to do it. If you've ever taken yoga before, they do teach it well. And that's what I usually bring. Have you taken yoga? Well, yeah, do that breathing. That's different than maybe just stopping and taking a breath.
Sure.
It gets way down. Another thing I've learned, because I'm also trained in EMDR therapy, which is eye movement, desensitization, reprocessing. That's a trauma therapy. We bring in a lot of grounding techniques with that as well. And that breathing, I usually will tell people, figure out where that body sensation is. Okay, so I said earlier, my anxiety shows up stomach drop. I'm going to breathe to that stomach drop. I'm going to breathe in, and I love visuals. I love analogies. So I say, give that stomach drop a color.
Okay.
So mine is usually orange. Why? Inside Out anxiety was orange. It just, that association stuck. And then I breathe in blue, like a teal. That's my calm color. And so I breathe in the blue and I breathe out the orange. And that visual really is effective for people to just slow it down. Because when we're dysregulated, it's not slow at all. Not slow. I also, if trauma is in our nervous system, process through that. Usually it's taking us to either past, we're worried about future, we're not here in this moment. I tell people in my office, in this moment, are you safe? Yes. Well, then let's tell our brain we are. So that is 5 things. You look around the room and say 5 things you can see, 4 things you can touch or feel, 3 things you can hear, 2 things you can smell, 1 thing you can taste.
And that signals to the brain you're safe.
Because you start noticing what's around you. Like right now, as I'm in your studio, I know I'm safe. There's not a bear standing behind that door ready to attack me, which I always tell people. Our brain does not know the difference between a bear chasing us in the woods and maybe whatever trigger is in front of us right now. So we have to remind our brain, we're safe now. Like your house, you're safe there. From as far as I know, you are. It sounds like you're making it a very safe environment, so you can remind your brain and body, we're safe here. And when it comes to couples, it's reminding them, you guys are safe together. Like you're not in this one against the other, which a lot of times when we are all triggered, we do feel very much like we're on opposite sides, but you're not. You're both here for your family, your baby, for each other. Let's figure out a way to communicate that effectively. The only way we can do that is to be regulated. You can't communicate in dysregulation.
No.
So.
No. No. And when side note, like with kids, I tell Daniel and I recently had this conversation. We're like, how are we supposed to expect them to regulate when we can't even regulate when talking to them and out of the thing? And that's the same thing for the postpartum and the perinatal. How can I be regulated and expect my husband to be regulated if we're not regulated communicating?
And just know too, you add that sleep disturbance in there. It's really challenging to be regulated when you're tired. Because that lack of sleep, again, our brain is computing that as a threat. Because if we go back to way back when, beginning of time, if you were up for a long period of time, it probably because there was a threat around the corner. I also want to bring in a really harsh fact that like within the last, say, 50, 60, 70 years, like advancement in medicine occurred. Like things have changed for when it comes to having a baby, but we're talking 100, 200 years ago. you could die giving birth.
Yeah.
And that can still happen today. I'm not downplaying that, but it was way more common because we did not have all the medical advancements.
Yeah.
Like almost like get to that anthropological level. Like our brains still are like, when we go through labor, like, oh, are we going to survive
Isn't
this?
that so fascinating how the brain does that?
Oh, yeah.
It's mind-blowing to me, and I still can't wrap my head around how the brain still is connected to ancestral and all the back. But for men, okay, so to have a plan of care and action before it hits, what are some things, and again, so if you're a woman listening to this, making a list of the things that you need to be watching for and for your husband to be watching for, but also allowing, because for men, this is hard to accept that, for men to understand, if you could just hear this one piece from both of us, it's not your fault that you feel that way. Exactly what Katie just said. Our brains are wired a certain way. We don't have control over that, but what we do have control over is how we handle it. So, Katie, what are some signs that men need to be looking for in that space of depression and what they need to be doing
For themselves or their partner?
themselves?
Okay.
And what they can do for their partner too.
So men, a lot of go-to in men's mental health I've even heard about on podcasts have been this checking out. And they check out in a variety of ways and in very actually socially appropriate ways. A lot of men check out at work. If I would rather be at home or at work right now than home, that's a huge red flag. Why? Is it because you're feeling inferior? A lot of times men see their wives. And if the wife is doing really well with postpartum and they just know, oh, the cry happens, I need to feed the baby, and they just know that, and men's like, how does she know that? You know? And they almost feel like, what's wrong with me that I can't figure this out? So that plays a part. If you're asking yourself those questions, what's wrong with me in all of this, that's a red flag. But I think the big behavioral thing is when you want to check or numb out. So I would rather be at work. I'd rather be scrolling on my phone, whether it's politics, social media, or a lot of times games. Like if you'd rather do that, video games in themselves. If you start to increase alcohol consumption or cannabis consumption or any substance, really, that's a red flag. And those are things you see with men with mental health, is just wanting to check out. This is too much. I'm overloaded. I'm out. Which again, you go way back when, probably is very helpful. If men who were hunting probably needed to check out a little bit. If they saw a big moose in the woods that could kill them, they needed to check out from that emotion to be able. So everything stems back to the way humans used to live their lives, really.
And what would you say? So they're noticing those signs. What is a plan of action you would say for men?
I'll reach out. And I know that might be hard.
So like their provider, therapist?
A therapist. Again, if your wife has seen, especially a perinatal specialist, reach out to them. There's not a lot of us here in Southwest Missouri, unfortunately.
There's really not.
And I know sometimes you want to keep some of these clients separate. I would ask a colleague if they felt comfortable, and if not, I would just do it because I have this skill set and knowledge and knowing what's going, like typically, or what could be happening in that household to provide that space to process through it. Because a lot of times, too, with men, they're telling themselves stories from their childhood, too, that maybe their dad was a master checker outer. That's a terrible phrase. But, you know, they saw that modeled for them of working all the time, coming home and numbing out to a baseball game or a beer or something. And that's how they learned to be a dad. And that, again, is just breaking those generational patterns that we learned from our parents, which every adult I work with, I say, our parents did the best that they could with what they had available. My mom and dad did not have mental health support when they were raising me. And my mom even said the other day, I probably had some postpartum mental health concerns. And with knowing her story, probably. So it's like, you know what? They didn't have the help, though. It wasn't available. It wasn't for them. Whether they were telling themselves that or reality. So our parents did the best that they could. It doesn't mean that it didn't impact us negatively. Both can be true.
And I think, too, Because the way I kind of look at that is we also have to, like, now we have podcasts.
Yeah.
So many books, so many education pieces, so many outlets to where I think our generation doing the best we can with what we have, but also searching out to add to that, you know, so that we aren't in that cycle of just, you know, I was going to say something to you about men. Oh, yeah. So for men, what are things that they can be doing to look for in their spouse? And also, how can they react and care for their spouse in that? Yeah.
Something I always just say is everyone wants to be seen, heard, and known.
Yeah.
And so really probably during pregnancy, learning how to truly listen to each other on that deeper level than just, hey, what are we getting from the grocery store this week?
Yeah.
How are you actually doing? If you need to start bringing in some sort of like scale 1 to 10.
Yeah.
You know, 10 is the worst ever, 1 is the best. Where are you today? Just learning how to communicate before baby's even here is a beautiful thing. If, hey, you're right now, you're like, baby's here. How do I do it now?
Yeah.
Just start.
Yeah.
If you are seeing in your partner, they are not themselves, and it's past 2 weeks postpartum, and you're noticing they're not sleeping, they're acting like they're, quote, superwoman when they're really not. They're struggling so hard, and they feel like they have to do everything.
Yeah.
I think I hear a lot of time from women, I just want them to know what to do.
Yeah.
Look around your house. Can you fold a load of laundry?
Yeah.
Can you get the dinner in the crock pot and let her go lay down? And then gently have those conversations of, hey, I see in you working so hard right now, and you're doing an amazing job, and I am worried about you're not sleeping.
Yeah.
You're not eating much right now. Like, is there something else going on besides just being up with the baby? And I think when we come from that place, again, I would start with that. You're doing so good.
Yeah.
And I'm noticing this. I think it comes less threatening to that. I would hope. I mean, honestly, when you're dealing with also mental health challenges, everything can be perceived as a threat. So I understand if a woman's like, oh, defensive, and just knowing to that partner and that it's not you.
Yeah.
They're just.
And I think that it's me. So, because I've seen, just observing, I've seen some men when the baby's not attaching to them, which it's the baby's been in the woman. Like, it's not personal, guys.
No.
Like, even Katie, it's not personal. And because they are a provider, because they are, it is easy for them to go in defense mode and think, well, this baby, what did I do wrong? Like, what am I? And to make it about them. And I think when doing that, they shut down all around. And it's like what you just said is, okay, while the baby's feeding, while the baby's doing everything attachment to mom, well, what can you do outside of that? Like what you just said, the dishes, the laundry, what can you do that doesn't have to do with baby attachment that is helping mom?
And really, one thing with perinatal mood and anxiety disorders, especially postpartum psychosis and postpartum bipolar disorder, which is a thing, sleep is the utmost. Like if I was working with a woman who has a diagnosis of postpartum disorder and is pregnant, I'm going to say you have to be relentless about sleep, which almost every mom might have just heard that and laughed. Like, how are you supposed to do that with a 2-day-old baby? You do it by working with your partner and working with your support system on, okay, from 10 p.m. or maybe you put baby down for the night at 8 o'clock. You're going to bed and you're not waking up until, say, baby wakes up at 3 or 4 o'clock. That's when you're going to be on shift. Husband can probably take a nighttime feeding or help out a little bit. My husband in the beginning, probably not baby. We were in a very different situation. He had to go back. He honestly went back to work. I was home. Let's say I had baby. He was back to work, I think, the very next day after I came home from the hospital. I mean, he had no time off. So it was just a different time. But I know for baby number 2, we worked together and I would feed, pass off. He would burp. He would change, put baby back to bed. From like pretty much 8 p.m. to 3 a.m. So I just had sleep. And even if I had it, honestly, any mom who's had more than one kid, you know, like you can feed and not actually fully wake up. It's
100%.
possible. Like I would just literally roll over, feed baby, roll back over and go back to sleep.
Yes.
And then he just did it because, and with our daughter, he did that too. Cause I was very honest with him. I said, I need help.
Yeah.
And so just working together, again, you know what's best with you or in your family. Like how can you guys, because I will also say those nighttime feedings is a very bonding act. And even if you're not feeling super bonded to this baby, that baby's going to bond with you because babies are walking nervous systems. All they know to do is eat, sleep, and poop. And that eating is an attachment time for them. Yeah. So you actually will develop really good attachment with your child if you also take a nighttime shift of feeding that baby. That eye to eye. I even say...
As a man.
Yeah, as a man.
How interesting.
It's possible.
Yeah.
There's that eye to eye. Skin to skin with arms, and that is so soothing and helpful for babies, and they will associate you as another caregiver.
So I knew skin to skin. I knew all of that. I didn't know feeding was a way of attachment for baby to male.
I mean, just
in
I don't have research on that. I don't have anyone like expert telling me that, but babies just attach so much because I have a need and you're meeting it. Yeah. And I know that you're a person that's going to meet my needs. That is bonding right there.
That's interesting. Yeah, no, that does make complete sense. Okay, end us out, Katie, on one thing that you want women to take away there's so much they could take away, but one thing that you want them to know in this journey to feel safe, seen, and known.
You are not alone.
Yeah. Yeah.
You're not alone. Mm-hmm. And I hope as we talk about it more, we all will know that because more people will say, yep, I had postpartum anxiety. Yep, I had postpartum psychosis. And just knowing that it is a human experience, not necessarily that there's something wrong with you.
Yeah. Yes, 100%. Katie, thank you so much.
Oh, thank you so much.
So great. Okay. All right, guys. We will chat next time.